You have no clue of that person's situation except their medical condition.
I like to be educated, but I'm so frustrated. Hello to my loneliness.
Hello, I'm Bernice Odudu, your host. At Caring Heart Channel, nurses learn strategies to navigate the complexities of the healthcare system and break the barriers which limit them from succeeding. Whether you are a new graduate, immigrant, or seasoned nurse, you will learn practical tips to build confidence, overcome cultural shock at work, and advance your career. Thank you to all my subscribers and viewers who take time each week to watch and share my content. Your feedbacks via email have been helpful so far in this journey. Now, the focus of today's episode is on how a nurse can care for a challenging patient and ensure they feel valued. It is necessary for the patient's overall well-being to cultivate a relationship with them that is constructive and empowering. A patient will forget the medication and other treatment that was provided, but what they will never forget is how a nurse or any other healthcare personnel made them feel. It is therefore necessary as a nurse to provide compassionate care for every patient in their care. The care you expect to be provided for you and your loved ones. You might have encountered a situation when a patient under your care began to act up, yelling and using the F word at you, and you stood wondering what you did or said to upset the patient. Indeed, I have encountered situations of this sort, not once but several times. The first time I was so confused and was almost in tears. I just received a report and was about introducing myself. Suddenly, the outburst was, "Get F out of here." I couldn't feel my feet. I was stunned. When I turned around, the outgoing nurse beckoned me to come out of the room. "Oh, that's how he behaves," stated the nurse. "But you should have warned me or given me a clue, at least," I said to the nurse. "Oh, he's nice sometimes," she said. After a couple of hours, when I went back to the patient's room, he broke down and was apologetic. He shared with me how he's been going through financial and relationship issues. He lost his job as the medical conditions prevented him from performing his duty. Adding to this problem was his girlfriend of over 6 years who broke up with him in the midst of his illness and hospitalization. At the time I walked in, he was so frustrated with the back and forth discussion with her. I was so moved by his story. I tried my best to reassure him and provide him with resources he needed to overcome the difficult time he was experiencing at the time. Sometimes a patient is frustrated from personal issues and just want to vent their feelings, but might have no other way than to lash at anyone present at the time. Overwhelming situation could sometimes render a person powerless. Nurses have been attacked verbally, physically by patients without provocation. You have no clue of that person's situation except their medical condition. How then can a nurse go beyond the patient's medical issues to care for the patient as a whole? That is where holistic care knowledge plays a vital role to help the nurse care for a patient's body, mind, and soul to prevent ugly situations. Holistic care is a topic for another day. Why should a nurse make a patient valued? 1, it can help build trust. 2, it shows the nurse is compassionate. Doing so can improve patient outcome and satisfaction. Now, let's dive in and discuss some useful practical tips that nurses can utilize to deal with challenging patients, family, and ensure they have the best care. 1, build trust and rapport. When you first contact someone, present yourself in a cheerful and upbeat manner. Doing so will make the patient feel at ease with you. Make sure you give the patient your undivided attention and actively listen to their worries and concerns. Make sure you communicate effectively and clearly by utilizing straightforward language. This is very important. Remember, communication is not only verbal but non-verbal as well. 2, Put active listening into practice. Give careful consideration to the patient's concerns and needs. Doing so will make the patient feel you truly care. Refrain from interrupting them and give them the opportunity to express themselves. Consider what they have said and respond with empathy to show that you value what they have said to you. To guarantee that both parties fully comprehend what another's points of view, employ therapeutic communication approaches such as summarizing and paraphrasing. During encounters, it is important to keep an eye contact and project a loving presence. 3. Demonstrate genuine empathy. Patient-centered care relies heavily on nurses demonstrating empathy. Put yourself in the position of the patient and recognize the feeling they are experiencing. Being sick and in care outside the comfort of their home is overwhelming for anyone, not to mention the teeming social, financial issues of everyday life. To provide resources and support, it is helpful to offer a light touch or other reassuring gesture. However, keep in mind their cultural belief and tradition. As in some cultures, touching by an opposite sex is a taboo and considered inappropriate. Before you reach out to touch someone from another culture, you may want to take their culture into consideration, and you might want to ask for consent. This is why learning others' culture and beliefs can help the nurse provide patient-centered care. To promote open conversation, you should inquire about their health using open-ended questions. 4. Involve patient in decision-making. Involving patient in decision-making is very important as it helps to empower and engage the patient in their own care. By describing different treatment alternatives to them and including them in the process, bearing in mind that sometimes patients act up because they were not involved in the care. Nurses should avoid the use of words such as "your doctor orders such and such." Before proceeding to carry out a new order, utilize cues to verify if the doctor or any other provider has discussed the plan of care. Queries such as, "Hello John, when last did you speak with your doctor?" Or, "Could you tell me more about the discussion you had with your doctor earlier?" Asking a question like this will provide a clue if the treatment and care was discussed with the patient. Respect the patient's rights, especially when concerns are voiced regarding treatment. Involve the provider as soon as you can to speak with the patient in person. Encourage patients to ask questions and provide them with thorough information. Doing so will help them make decisions about their health care that are based on accurate facts. Instill a sense of self-determination in patients by showing respect for their autonomy and their individual preferences, like the type of food preferred, religious observance times, and the time they prefer to take routine home medication. Avoiding argument will save the nurse time for other tasks. Be flexible to work around their preferences and involve other healthcare professionals such as doctor, social worker, and trusted family members. 5. Educating the patient and offering support is a great way to empower your patient. Communicate pertinent information regarding the patient's health treatment and self-care practices with the patient. Improve patient education by utilizing technological tools in a smart way. Printed materials or visual aids such as brochures are very helpful tools at the time of admission or encounter. Encourage patients to ask questions and resolve any misconceptions or uncertainties. Remember to utilize the support of other interdisciplinary team, family, and colleagues. Make available to patients and their family a variety of resources as well as support groups to encourage continued education and ease fear and anxiety. 6. Cultivate a positive atmosphere. To cultivate a positive atmosphere, you should create an inviting atmosphere by keeping the patient's room clean and organized. Address patients by their preferred name during care interactions to offer a personal connection. When giving care, be sure to consider the individual's preferences. Address patients by their preferred name during care interaction to offer a personal connection. When giving care, be sure to consider the individual's culture, religious, and spiritual belief. This should be part of handover communication. Include the patient's family members and loved ones in the caregiving process in order to cultivate a sense of community and support for the patient. The nurse may play a significant role in the process of helping the patients feel valued and appreciated if they put these strategies into practice. Remember that the goal is not just to provide medical care, but also to create an atmosphere that is therapeutic and foster emotional well-being. My question for you is, which strategy have you utilized in difficult situations? Leave your comment. Thank you for watching. Please subscribe to Caring Heart. And if you do find these practical tips useful, share this video. Remember, a caring heart makes a difference.
I wish I knew